Alright, before we get to the cardiac failure as such, we got to know few basic principles about the topic and about the terminology in specific. Now in the past, the same disorder was called as congestive heart failure. Alright, the same topic, the same terminology was called as congestive heart failure or congestive cardiac failure, guys. Now the recent terminology, as per American College of Cardiology Foundation, they have renamed the congestive cardiac failure into specific terminology called pure heart failure or just cardiac failure, that is all. The word congestive has been taken off. Why? Because when it comes to the word congestion, it implies that patients presents with symptoms of congestion. Got it? So if you consider what are the symptoms of congestion, you need to know what congestion basically means. It's nothing but a tissue that gets flooded with blood. So any tissue or organ in specific, if it gets congested with blood, if it gets stuffed with blood, it's going to throw off its own manifestation, and that we describe as congestive symptoms. The problem with a patient of heart failure is not every patient is going to present to the OPD with a specific or typical congestive symptom, which is why we can't get ourselves fooled or we can't get ourselves distracted just because a patient is presenting to OPD without a congestive symptom, thinking that he is not suffering from cardiac failure. So people, please remember, cardiac failure is a dysfunction of heart. Now that need not to be present with congestive symptom. So in case if you are following an old edition textbooks, you might get to come across this word congestive cardiac failure. But in case you are following a newer edition textbooks or clinical medicine textbooks, you will be getting through the word called heart failure or cardiac failure, but the word congestion will be missing. Do not worry. The old terminology is congestive cardiac failure. The newer terminology is simple cardiac failure or heart failure, people. So cardiac failure is also called as heart failure. It's also called as heart failure. Now let's get to know what is what first of all, people. Let's get to see what is the definition and what is heart failure. When it comes to the definition, guys, there has been very many attempts to define what exactly is cardiac failure. So different statutory boards, different organizations do came up with their own definition of cardiac failure. Now we can't blindly follow X and Y organizations. When it comes to medical learning, we need to follow the best statutory boards that gives us the recommendations. So guys, as per American College of Cardiology Foundation, American Heart Association Foundation, the definition of cardiac failure gets restricted to very simple presentation, wherein we see a structural or functional impairment in cardiac contraction or cardiac relaxation or both. Alright, there is a clear-cut structural deformity in heart that makes the heart not to contract properly or relax properly. On the other side, there is no structural abnormality, but there is a functional restriction in the heart which is making the heart not to contract properly or relax properly or both. So this is what is called as cardiac failure. We see in our patients a structural reduction or a functional impairment in either contraction or relaxation or both is what is called as cardiac failure, guys. This is cardiac failure or heart failure. Now, what you need to know in this topic in specific. As of now, at this point of your medical curriculum and training, you need to be completely familiar with the pathophysiology that is leading a heart to get into cardiac failure. So let's take up the pathophysiology, guys. Alright, when it comes to pathophysiology of cardiac failure, first thing first, there is always an event called index event, and that index event is the triggering factor for a normal heart to turn into a failed heart. Got it? So you always have a presence of an event called as index event, and this index event, doctors, is going to damage the cardiac tissue. The index event is going to damage the cardiac tissue. And this damage causes cardiac failure. Alright. Now, what is the index event? Any event that is attempting to disrupt cardiac architecture or function is called as an index event. We can categorize index event into two broad divisions. There can be any acute index event or a chronic index event. What are the acute index events that tries to damage the heart? For example, myocardial infarction. Myocardial infarction predominantly, or to some extent myocardial ischemia as well. Alright guys, myocardial infarction or myocardial ischemia are a index event that is attempting to disrupt cardiac architecture. On the other hand, if you take up any chronic event, events, very high pressure overloading over a heart or a volume overloading on a heart. When a cardiac chamber experiences too much of pressure over a prolonged period of time, or a cardiac chamber is experiencing significant expansion of volume for a prolonged period of time. So such gradual, progressive, chronic over expansion of volume or over expansion of pressure is what is called as volume overload or pressure overload respectively. So guys, in cases of volume overload or in cases of pressure overload, there happens to be a damage to cardiac musculature and structures.